Hello, ladies and gentlemen. My name is Lubogo, and today we're going to discuss a very wonderful topic called cannabis and cat, what some people call Njaga. And it comes from the book that we wrote called A Legal Appraisal of Njaga or Cannabis and Associated Medical Herbs in Uganda, the need to decriminalize or delegalize. Now, the delegalization and potential decriminalization of cannabis and cat are topics of growing interest and debate in many regions around the world, including Uganda. These plants are known for their historical culture and even economic significance, and therefore they've been a subject of diverse legal and regulatory approaches. So in this discussion, I will try and explore how Uganda can potentially contribute to decriminalization and delegalization of cannabis and cat, okay, considering the experiences countries have taken in terms of, benchmarking. So it is essential basically to strike a balance between addressing the potential drawbacks associated with these substances while capitalizing on their potential benefits. Not so. And therefore we will examine some global best practices, how Uganda can be informed in terms of evidence-based policies to navigate the complex landscape of cannabis and cat regulation. So this discussion will outline the key steps and strategies taking into account the experiences of successful countries in the domain so that Uganda can actually co-opt, adapt, and learn. I'm going to provide for you an overview of cannabis, cat, and medicinal herbs, their potential advantages and disadvantages. Okay, we're going to get that from my book, A Legal Appraisal of Njaga Cannabis and Associated Medical or Medicinal Herbs. What is cannabis? Now, cannabis is often referred to as marijuana. It is a plant known for its psychoactive and medicinal properties. It contains compounds called cannabinoids with delta-9 tetrahydrocannabinol, what they call THC, and cannabidiol, CBD, is the one that's probably known by many people. In terms of advantages, it has medicinal purposes. In terms of cannabis has been used to treat various medical conditions such as chronic pain, nausea, and even muscle spasms. Now, CBD in particular has gained popularity for its potential therapeutic properties without, the psychoactive effects of THC. Number two, recreational use. Some individuals use cannabis for relaxation, creativity, and even stress relief. Number three, in terms of industrial uses, it's used for hemp. A variety of cannabis is actually used for industrial purposes, for making textiles, paper, and even biodegradable plastics. Think about that. In terms of disadvantages, it has what they call psychological effects. So THC can actually cause altered perception, impaired memory, and even paranoia. Heavy or even prolonged use can actually lead to addiction and even mental issues. Yeah? Now we're talking about legal issues. Now the legal status of cannabis varies, as I said, widely around the world. And it may be illegal in some areas, just like Uganda. Not so. In terms of health risks, smoking cannabis can actually harm the respiratory system, and excessive use can actually lead to what they call cognitive impairments. That is extremely important for you as a preamble. Now, in terms of cat, what people call Miraa, yeah? What is cat? Cat is an evergreen shrub native to East Africa and even the Arabian Peninsula. Its leaves and stems are chewed, for their stimulant effects due to, the presence of what they call cathinone and cathiene. Remember that. Now, in terms of advantages, it is a stimulant. Cat can actually produce stimulating effects, increasing alertness in terms of energy and in terms of sociability. Number two, it can also be used in terms of cultural and social use. In some regions, cat has actually cultural and social significance, often being used in communal settings. Number three, in terms of disadvantages, it has what they call health risks. Now, long-term cat can actually lead to what they call negative health effects, including dental problems, or what they call cardiovascular issues and mental health problems in general, or even dental problems for that purpose. And then in terms of legal status, the legal status of cat varies again from country to country, where some nations have actually banned it due to health reasons. Now, in terms of dependency and addiction, it has that aspect of, if you're going to use it for a long time, prolonged use can lead to dependency and withdrawal symptoms and even addiction, which are very, 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 very serious issues. Yeah. Now, In terms of what they call medicinal herbs, we're going to talk about some different kind of medicinal herbs, using that word, widely. Medicinal herbs encompass a wide range of plants used for their therapeutic properties. For example, what they call ginseng, or even another they call echinacea, and another they call chamomile. Okay, take note of this. In terms of advantages, these have what they call natural remedies in terms of medicinal herbs that are often seen as natural alternatives to conventional medicines for various health issues. Number two, they have an advantage of being what they call low risk, in a sense that many medicinal herbs have fewer side effects and lower risks of addiction compared to pharmaceutical drugs. Number three, they've also got what they call culture and traditional use. So many cultures have actually used medicinal herbs for centuries in traditional medicine practices. Perhaps many of our grandfathers and mothers have actually been, part of this. In terms of disadvantages, they may lack what they call regulation. Medicinal herbs are often less regulated than pharmaceuticals, which can lead to issues of quality and even safety. And then also, in terms of another disadvantage, they have what they call limited scientific evidence. Now, while some medicinal herbs have proven to be, therapeutic benefits, some scientific research may be limited for others, making it hard to determine their efficacy. And then another aspect is what they call potential interactions. Medicinal herbs can actually interact with other medications, leading to adverse effects. So please note that the advantages and disadvantages can actually vary depending on specific herbs, in terms of its preparation, in terms of dosage, in terms of individual factors. So it's important for you, my friends, to always consult with healthcare professionals before using any herb for alternative remedies. Be aware of the legal status of any substance in your area. I'm emphasizing that because the jurisdiction in terms of the law is extremely important. Now, cannabis basically contains a variety of chemical compounds. The most well-known of which is called what they call cannabinoids. So these compounds have different effects on the human body and play a significant role in the plant therapeutic potential. Here are some of the cannabinoids and their potential advantages. Number one is what they call delta-9 tetrahydrocannabinol, what they call THC. In terms of advantages, it has what they call psychoactive effects. So THC is primarily responsible for the high associated with cannabis, and it is induced relaxation, okay, what they call euphoria, and increased sensory perception. So when you feel that high, it's because of that particular chemical. It also helps in terms of relief. The THC can be effective in terms of managing what they call chronic pain conditions. It also has an aspect in terms of what they call appetite stimulation. It can be used to stimulate appetite, especially in patients undergoing chemotherapy. In terms of disadvantages, the THC can actually cause what they call anxiety, in terms of paranoia, and also in terms of impaired cognitive function, especially in high doses. And there is a risk of dependency. So long-term, in terms of heavy use, can lead to dependency and even addiction, right? Now, let's talk about another chemical found in cannabis, which we call cannabidiol, what they call cannabidiol, what they call CBD. Now, in terms of advantages, it has what they call a non-psychoactive. Okay, so CBD does not produce psychoactive effects associated with THC. Now, it's also helpful in terms of pain and inflammation. It has been used to alleviate pain, reduce inflammation, and even manage certain medical conditions. It's also helpful in terms of seizure control. So CBD has actually been effective in reducing what they call the frequency and the severity of seizures in some forms of epilepsy, right? And in terms of anxiety and mental health, some studies suggest that CBD may actually help to alleviate symptoms of anxiety and even depression. Now, in terms of disadvantages, it has got limited regulation. So the quality and the purity of CBD products can actually vary, and not all claims about effectiveness are supported by scientific evidence. So that's why we have to be very, very careful when we're dealing with that. Another chemical that is found in cannabis is what they call cannabinol, what they call CBN. Now, in terms of advantages, it has what they call sedative effects, in the sense that CBN is associated with the sedative and relaxing properties, And in terms, it has also got a potential as a sleep aid. It may help with sleep disturbances and insomnia. And in terms of disadvantages, it has less research that has been carried on, and there are relatively less scientific research in terms of CBN compared to THC and CBD. Another chemical found in cannabis is what we call cannabigerol. what they call CBG. Now, in terms of advantages, it has what they call anti-inflammatory. So CBG is thought to have what they call anti-inflammatory properties in terms of what they call potential anti-oxidant. It may have what they call oxidant effects. Okay. Another disadvantage it is in terms of limited research. So like CBN, there is still limited research on CBG. Yeah. Now, as I said, it is essential to note that the advantages and disadvantages of cannabinoids can actually vary from one person, and the scientific undertaking of these compounds is continuously evolving. So the therapeutic potential for cannabinoids has led to interest in medical cannabis for various conditions, including what they call chronic pain, epilepsy, and even multiple sclerosis and certain mental health issues. As again, I will emphasize, we have all captured all this in our book, A Legal Appraisal of Njaga Cannabis and Associated Medical or Medicinal Herbs in Uganda. Now, the legal status of cannabis and its components, as I said, varies worldwide. So in some regions, it is some areas can be medical. Cannabis is actually legal and regulated, while others, it remains illegal, just like Uganda. So research into these medical benefits and potential risks of cannabis is actually ongoing, and medical professionals should actually be consulted before considering cannabis as a treatment option. Yeah, that is extremely important. Now we're going to delve a little bit deeper into the components of cannabis and their potential advantages on the human body in terms of health and the broader societal context. That is extremely important. I am making this background for you so that you understand why when you talk about delegalization or perhaps legalization, we need to understand why. So this is what they call cannabicromen, what they call CBC. In terms of advantages, as I said, it has what they call anti-inflammatory aspects. CBC has shown to have anti-inflammatory properties, which can be valued in managing what they call inflammatory conditions. Number two, it's essential in terms of pain relief. It may contribute to pain relief, although more research is still needed. Number three, it has a chemical that they call tetrahydrocannabinolic acid, which they call THCA. In terms of advantages, THCA is a non-psychoactive precursor to THC. It is generally found in raw cannabis, and some people believe it may have what they call anti-inflammatory properties, although scientific evidence is actually limited when it comes to that. Yeah. Now, in terms of another one, is what they call cannabidiolic acid, what they call CBDA. In terms of advantages, CBDA is another non-psychoactive component, and it's found in raw cannabis. It's thought to have what they call anti-nausea and anti-inflammatory effects. Yeah. Now, in terms of advantages, advantage of cannabis in a broader context help in terms of pain management. As I said, cannabis has actually been used to manage various types of pains, including chronic pain, in terms of conditions, including what they call neuropathic pain, and also pain associated with cancer. Yeah, it's also necessary in terms of nausea and vomiting. It's often used to alleviate nausea and even vomiting, particularly in patients undergoing chemotherapy. Now, in terms of what they call epilepsy, certain forms of epilepsy have actually been shown to be responsive to cannabis in terms of treatment. And in terms of what they call neurological disorders, some studies suggest that potential benefits in managing conditions like multiple sclerosis or even Parkinson's disease is another advantage that cannabis has. Now, in terms of mental health, while effects can actually be complex, some individuals use cannabis to alleviate what they call symptoms of anxiety, in terms of depression, and even in terms of what they call PTSD. We shall get to know that. Now, in terms of appetite stimulation, it's also used to stimulate appetite in individuals with conditions that result in decreased appetite and even weight loss. And then another aspect in terms of what they call glaucoma, cannabis can actually help to reduce intraocular pressure in terms of glaucoma patients. Yeah, please understand that. Now, in terms of disadvantages and considerations, we could look at the psychological effects. Now, high THC cannabis strains can lead to anxiety, paranoia, and psychosis, okay, in some individuals. And also in terms of additional potential, cannabis can actually lead to dependency, particularly those who use it heavily, okay, or who started using it at a young age. It can also have issues in terms of respiratory issues. Smoking cannabis can have harmful effects on the respiratory system, so alternative consumption methods such as vaporizing or even consuming edibles can actually reduce the stress. Right? And then an aspect of cognitive impairment. Long-term heavy use, especially in adult senses, can actually affect cognitive function in terms of that. And then if you're arguing in terms of legal status, the legal status of cannabis and these companies varies widely across countries and states. Yeah, so it's extremely important, my friends, to highlight those scientific research on cannabis and its components, which is still evolving. So many studies are still ongoing to better understand its potential advantages and even the disadvantages. So if you're considering using cannabis for medical purposes, it is always advisable to consult with health medical cares, especially in regions where medical cannabis is legal and regulated. Not so. Always adhere to the laws of the land regarding cannabis. That is extremely important. I will super overemphasize that. As I said, we have discussed all that in our books in terms of the legal appraisal of Njaga cannabis and associated medicinal herbs in Uganda. Now, what are some of the components in terms of cannabis, other components? We could argue in terms of what they call cannabis general, what they call CBG. I probably mentioned that CBG is considered what they call the mother or the stem cell. So in terms of what they call cannabinoid, because it serves as a precursor to other cannabinoids like THC and even CBD, it has shown promise in some what they call preclinical studies for its potential in terms of inflammatory and even neuroprotective properties. So CBG may also have what they call antibacterial and even antifungal effects. Yeah, and then another element or component is what they call cannabinoid-chromen. Okay, cannabinoid-chromen, what they call CBC. In terms of advantages, CBC is a non-intoxicating and has actually been studied for its potential to block pain and even inflammation associated with the collagen-induced or osteoarthritis. Yeah. So some research suggests that CBC may actually enhance the therapeutic effects in terms of THC, which can be permanently relevant in terms of medical cannabis products. So we're seeing all these components, extremely important components. There's what they call tetrahydrocannabinol, okay, what they call THCV. In terms of advantages, THCV is thought to have a role in suppressing appetite, which could potentially be useful for weight management and even obesity in terms of treatment. It may also have what they call anti-convulsant properties. Now, think about all those advantages in these things, yeah? And I'm gonna put it to you to weigh and see what would be better for us. In terms of advantage of cannabis, in terms of broader context, inflammatory conditions, for example, we're arguing that some individuals use cannabis to manage what they call various inflammatory conditions, including arthritis and also what they call Crohn's disease. Yeah. In terms of cancer, cannabis is actually studied for its potential in terms of cancer treatment, including a complementary therapy to manage side effects of chemotherapy and even radiation. Beautiful, beautiful, beautiful things. Not so. Now, in terms of what they call post-traumatic stress disorder, yeah, it may help to alleviate symptoms of PTSD, yeah, and other trauma-related disorders, yeah, and also what they call autoimmune disorders. So there's a growing interest in using cannabis for what they call autoimmune conditions due to its potential immunosuppressive and anti-inflammatory effect. So think about all those things that I'm talking about. Now, there's also what they call neuroprotection. Yeah, neuroprotection. Some cannabinoids have shown potential for protecting nerve cells, which could have actually, which could be valuable in terms of treating what they call neurodegenerative diseases. Yeah. In terms of disadvantages and considerations, again, it may cause what they call short-term memory impairment. So TH can actually lead to short-term memory impairment and even cognitive defects, particularly during intoxication. Yeah. In terms of driving impairment, cannabis can impair coordination and in terms of reaction time and judgment, which can actually lead to accidents when driving under its influence. Yeah. In terms of cardiovascular effects, cannabis can actually lead to increased heart rate and even blood pressure, which could have problematic, individuals lead to problematic individuals in terms of individuals with as far as cardiovascular conditions are concerned. And then in terms of mental health risks, there is a link between heavy cannabis use and the acceleration or the exacerbation of what they call mental health conditions, particularly those with what they call predispositions in terms of psychosis. Yeah, and then an aspect in terms of legal and employment issues. In many places, cannabis can actually impact employment in terms of legal status, particularly in jobs or regions with strict drug policies. Yeah. So again, I will super emphasize that please keep in mind that these neurotic potentials or therapeutic potentials are actually risk associated with cannabis, and its components can vary depending on the specific strains and dosages and even individual factors. So as I said, ongoing research is shedding more light on these aspects, and medical cannabis should be approached with care, guidance from healthcare professionals, and in terms of compliance with local laws and even regulations. Yeah, we're gonna explore a little bit of of cat, not so, what people call Miraa, also spelled as QAT or sometimes KHAT, in terms of its components and advantages and disadvantages. Now, cat or Miraa, for that purpose, has what they call Catha edulis. Now, what is it? Now, cat is an evergreen shrub native to East Africa and the Arabian Peninsula. Now, it's widely consumed for its stimulating effects, but primarily due to the presence of what they call alkaloids and even what they call cathinone and even what they call cathine. Take note of that. In terms of advantages, it is advantageous in the sense that it's a stimulant, it has a stimulant effect. Cat consumption is known for its stimulating effects leading to increased alertness in terms of energy, in terms of sociability. Its users often experience what they call highly heightened sensory perception and improved mood, yeah? And it's also, in terms of culture and social use, cat has cultural significance in some regions and is traditionally used in communal settings, often during what they call social gatherings and even discussions, yeah? And then in terms of potential therapeutic uses, in some cases, cat has actually been considered for its potential in treating conditions like depression and obesity, although scientific research is still limited in terms of that context, yeah? Now, if we're to argue cat in terms of disadvantages, as far as those components or whatever, the components that make it up, in terms of health risks, prolonged and heavy cat use can actually lead to various health issues, including cardiovascular problems and digestive issues, dental problems, and even mental health concerns, yeah? And it has a tendency of sticking with you. Dependence and addiction. Cat has the potential of dependence and addiction. And withdrawal symptoms. Withdrawal symptoms are terrible and can occur when it is actually, when the use even is discontinued. Withdrawal symptoms are terrible, my friends. Then it has what they call cognitive effects. Extended use of cat may actually lead to cognitive impairment, affecting memory and even concentration. And then there's what they call psychological effect. High doses of cat can actually induce anxiety and paranoia and even hallucinations, yeah? And then in terms of legality, the legal status of cat varies again from country to country. It's totally banned in some nations like Uganda, but others like Kenya, it's probably acceptable, yeah? So that is something you misunderstood. So cat is typically consumed, as I said, by chewing the flesh leaves and the stem of the plant, and the stimulant effects are generally felt within a few hours after consumption and can last even for several hours. So it is important to note that cat's advantages and disadvantages can vary, as I said, depending on the factors such as frequency of use or dosage and individual responses. Now, if we know that, maybe that's where we have a case in terms of delegalization or decriminalization. Now, the legal status, as I said, is a significant factor, and it is illegal in terms of many countries due to the concerns about its health effects and the potential for its abuse. So in regions, for example, where it is illegal or culturally accepted, or legal where it's culturally accepted, then it's important to be aware of the potential risks associated in terms of use and in terms of its moderation. So research on cat is still ongoing, and it's important, my friends, to consult with healthcare professionals for a more comprehensive understanding of its advantages and disadvantages. Not so. Now, we will give some little more information in terms of cat so we can understand exactly what we're talking about, yeah? Now, for cat, you may look out for a chemical called cathinone and another one called cathine. Now, cathinone is the primary, what they call psychoactive compound in cat. It's responsible for its stimulating effects. It is structurally similar to what they call amphitamides, which is why it produces stimulant-like effects, yeah? And then cathine is another stimulant compound found in cat, although it's generally, milder than cathinone, yeah? Now, in terms of advantages of cat, as I said, it engages in terms of what they call energy and alertness. Cat can actually increase energy levels, reduce fatigue, and also enhance alertness, making it attractive for those who need to stay awake and focused. Yeah, it's very popular with drivers. I think you're probably aware about that. Now, in terms of social interaction, the use of cat is often associated with increased sociability, which is why it is commonly used during social gatherings and even discussions. Yeah, and then in terms of disadvantages of cat, it's very important to note this because it has what they call cardiovascular effect. Cat consumption can lead to increased heart rate, blood pressure, potentially causing heart-related issues in individuals with pre-existing conditions. Yeah, so I think it's something that you could look at in terms of an evaluation of its advantages vis-a-vis disadvantages. In terms of digestive problems, it has extended use. Extension use can actually lead to what they call digestive problems such as constipation, stomach ulcers, and gum issues due to the chewing processes. Yeah, and in terms of mental health, cat cat can be associated with mental health conditions, including anxiety, what they call paranoia, and then in some cases issues in terms of hallucinations. Yeah, and then the aspect of dependency and withdrawal. Prolonged cat use obviously results in dependency and withdrawal symptoms like irritability, depression, and fatigues may occur even when consumption is actually stopped. So that's very important. I know some friends who have issues, friends in quotes, in a sense that I got to know them, but these withdrawal symptoms can be extremely callous. Yeah. Now, in terms of culture seeking, cat has actually been an integral part in terms of social and even fabric in terms of some regions. So, particularly in East Africa and Arabian Peninsula. So, the practice of cat chewing is often deeply rooted in tradition, and it plays a significant role in terms of social customs and gathering, as I just mentioned that. Yeah. So, even as we engage and we try to lay leverage or to lay a ground for decriminalization or perhaps legalization of these issues in terms of cat, in terms of cannabis, or perhaps in terms of other medicinal medicinal herbs. We need to carry out substantive research and debate becomes a question of importance. So it's not just enough for a country to come out and say this is the law. It's important that we carry out research and substantive research, so we can have a substantive report in terms of a due diligence that has been carried out for purposes of understanding the risks and highlighting those risks and the potential therapeutic applications of some of these important greenery that have been given by God, right? So therefore, such subjects like cat and cannabis remain a subject of interest and scrutiny due to their cultural significance, their potential health implications, and just like any substance. So it's very important to be responsive in terms of use, aware in terms of advantages and disadvantages, and it's recommended, as I said, to consult with professional health professionals so that you know, and also the law. What does the law say? And that is something that we need to comprehend as we diverge deeper into some additional aspects of these interesting contents that we're discussing today. Now, from the book that I wrote, you probably realize I'm trying to read off here my laptop. We argue in terms of chapter 1, for example, the use of cannabis, the components and the legality of cannabis, the medical uses perhaps that are important, the effects of using cannabis, the side effects of using cannabis, and then aspects of cannabis and withdrawal. Withdrawals, my friend, you don't want to get near a person who is engaging in withdrawal. It is something that is really cause for alarm. And in terms of economic significance, by the way, cat in itself, in terms of economic significance, by the way, cat cultivation and trade can have economic significance in some regions where it is grown. Yeah, and it serves as a source of income for farmers and traders, even local community. By the way, where tea can grow, cat can grow easily. Yeah, so that's extremely important. Now, we also talk about the effects of and the use of marijuana, for example, risk of stroke and transient, what they call ischemic attacks, and then in terms of education, and then the comparative study in terms of cannabis in other countries like South Africa, for example, and then the medicinal aspects that have to do with cat, then the global aspects of marijuana and the effects, and then issues to do with the Central Drugs Authority, regulatory authorities perhaps, in terms of delegalizing cannabis. And then some people, we will also offer alternatives to chewing. In some regions, for example, I'll give an example, cat is consumed in various forms beyond chewing. They may include what they call cat extracts or even teas made from cat leaves, which reminds me of that song. Or you remember that Amajani, whatever the chairman, Yakoza Acha Simayi Wata Demo Njai, those issues. Guys come up with different things. So we need to understand that these things these days are smuggled in different ways. I'm told even in cookies and in every kind of thing. So the argument here is the aspect of legalization or perhaps regulation or perhaps decriminalization, so that we can have maybe components in substantive forms that can easily be consumable for the body without having callous effects in terms of side effects or in terms of backfires, right? So it's important, as I say, because these things are now looked at on a global perspective. Cat use in terms of legal status very wide. Yeah, as I said, some people look at it as a cultural tradition, and so international discussions regarding cat status and regulations have actually taken place all over the world, reflecting diverse opinions in terms of their benefits and risks. So as I said, it is very important to recognize the significance, the legality of it, the social acceptance, that vary from one place to another, obviously, and then the advantages and disadvantages that are associated with the dependency of these issues, including cultural context, patterns of use, and individual experiences. So it's extremely important, as I said, to seek reliable information and to adhere to local laws and regulations, and that's where we are drumming the measure in terms of considering their use, in terms of their potential, in terms of health, in terms of societal considerations that are actually associated with them. To continue with the write-up here, we will probably explore certain other specific medicinal herbs and in terms of their scientific components, in terms of advantage to the human body, in terms of their potential benefit to the world. One that comes to mind is what they call ginseng, what they call Panax ginseng. Now, in terms of the key component, ginsenoids, which are unique to ginseng, have an advantage, for example, what they call adaptogenic properties. Yeah, so ginseng is also known as adaptogenic, which means it may help the body to adapt to stress and balance energy. Yeah, so you can see the strength of that. And then it has also what they call immune support. It has been studied for its potential in boosting the immune system. Yeah, and then in terms of cognitive function, some research suggests that ginseng may actually improve cognitive function and even mental clarity. Yeah, and then in terms of potential worldwide impact, ginseng is cultivated in various regions, including North America, even Asia, which can actually boost local economies to provide for what they call export opportunities. Yeah. If I'm to look at my book again here, I'm trying to scroll through so we can understand. We also have another that we call Echinacea, what they call Echinacea purpurea. Now, its key components have what they call alkamides and what they call caffeic acid, and also derivatives and what they call psychosaccharides. Yeah. In terms of advantages, it is important in terms of the immune support. Now, echinacea is actually commonly used to boost the immune system and even reduce the severity and the duration of these colds. Yeah, and it has also aspect in terms of what they call anti-inflammatory. It has anti-inflammatory properties that actually may benefit conditions such as respiratory infections, wound healing, for example. So echinacea ointments or creams are used for wound healing, for example, and even potential worldwide impact. Yeah, so echinacea is actually cultivated and even consumed in various parts of the world, contributing to local economies and even herbal medicinal production. Yeah, I'm going to take you through another interesting one that is very popular. Is what they call turmeric, what they call Cocama longa. Okay, Cocama longa or turmeric. Turmeric has certain key components, what they call cacaminoids, okay, with what they call cacamine, which is the worst known. In terms of advantages, it has what they call anti-inflammatory. So cacamine has potential anti-inflammatory properties and is used for managing conditions such as arthritis. Yeah, and then it is also used as an anxideodorant. Yeah, it has anxideodorant effects, potentially reducing oxidative stress and associated health risks. It is also a component in terms of what they call digestive health. So turmeric is also used for digestive health and may actually relieve symptoms in terms of indigestion. In terms of worldwide impact, turmeric is actually widely grown and traded, particularly in countries like India. Its production supports even local economies and spice trade. Yeah. Another interesting one that we're going to talk about is what they call chamomile, or what they call Matricaria chamomilla. Okay, in terms of component, it's what they call, it has a component called bisabocol, okay, or bisabobol. Okay, in terms of apigenin. In terms of advantages, it's used for relaxation. So chamomile is actually used for its calming and even sedative effects, promoting relaxation and even sleep. And it's also important in terms of digestive aid. It can help to alleviate symptoms of indigestion and even upset stomachs. Yeah, it can also be used in terms of what they call anti-inflammatory. So this chamomile has anti-inflammatory properties that actually benefit the skin in terms of their conditions. In terms of potential worldwide, this particular chamomile is cultivated in many regions and is a common ingredient in herbal teas, for example, in supporting local agriculture and even beverage industry. Yeah. Okay, if I'm to continue looking at the book again in terms of a discussion, I'll argue in terms of another one called Valerian officinalis. It's terms of key components. It has what they call valerianic acid and other vanillin oils. Yeah, in terms of advantages, it helps you in terms of sleep aid, and valerian is actually primarily used as a natural remedy for insomnia and even improving in terms of sleep quality. and anxiety relief, and it helps reduce symptoms of anxiety and even stress. Now, if you're arguing in terms of potential worldwide impact, valerian is actually cultivated in various countries, contributing to the herbal, medicine and supplement industries. Yeah? Okay. Another one that is popular in Uganda is what they call aloe vera. Remember aloe vera? Probably everyone knows aloe vera. Now, aloe vera, some people call it Arobebadanitis miller. Arobebadanitis miller. Now, as a key component, it has what they call polysaccharide in terms of glycoproteins and anthocyanins, right? In terms of advantages, it helps in the skin. So aloe vera is well known for its skin soothing and healing properties. It is used to treat what they call sunburn and even minor burns and even skin irritations. In terms of digestive health, some use aloe vera for its potential digestive benefits, including relief from constipation and even heartburns. Yeah. In terms of potential worldwide impact, aloe vera is cultivated in various tropical lands, including Uganda, subtropical regions, and it plays a role in terms of cosmetics, skincare, and even what they call pharmaceutical industries. Yeah. We're gonna go ahead and discuss another one, which you call lavender. Yeah. Now, lavender, some people call it Lavandula angustifolia. Yeah, in terms of a key component, it has what they call linalool and linal acetate. In terms of advantages, it is used for calming and relaxation. So lavender is known for its calming and stress-reducing effects, often used in what they call aromatherapy and even relaxation. Yeah, it's also important in terms of as a sleep aid. It can promote better sleep quality and reduce insomnia symptoms. Now, in terms of potential worldwide impact, lavender is grown in various countries and is a significant component of the essential oil and fragrance industry. Yeah, think about that. These are all important medicinal herbs, which we are saying, how about if we take some serious inquiry into them. There's another one they call St. John's wort, what they call Hypercurium perfortantum. In terms of key component, it has what they call hypercin and also hyperform. In terms of advantages, it's used for mood enhancement. So St. John's wort is used in its potential in alleviating symptoms of mild and even moderate depression. And also in terms of nerve pain, it may provide relief in terms of nerve pain and then discomfort. In terms of potential worldwide impact, St. John's wort is actually grown and even processed in many countries, and it is used in terms of herbal supplement industry. Yeah, and then I'm going to talk about another popular one that maybe all of us know, the Njaga. Some people call it Zigimba offinale. Okay, some people call it offinale. Okay, offinale. In terms of key components, Gingador, which is responsible for its pungent flavor and many of its health benefits, include things like digestive health. Ginger is commonly used to alleviate nausea, for example, motion sickness, and even indigestion. And then in terms of anti-inflammatory, it has also what they call anti-inflammatory properties and may actually benefit conditions like osteoarthritis. Yeah, so that's another important aspect. In terms of immune system as well, ginger may actually boost the immune system to help reduce the severity of cold and even flu symptoms. Yeah, and then there's what we call, in terms of its relevance for worldwide impact, ginger is cultivated in various regions and plays a significant role in terms of the global spice and also herbal medicine industries. Yes, so that's extremely important for us to understand. Another interesting one is what they call peppermint, or what they call mentha, or some people call it ex piperita. Yeah, in terms of key component, it has what they call methanol and even menthone. In terms of advantages, it helps in digestive relief. So peppermint is also known for alleviating symptoms of indigestion, irritable bowel, and even syndrome, what they call IBS, and also bloating. Yeah. In terms of respiratory health, it can actually help relieve congestion and even improve breathing. In terms of headache relief, also some individuals find peppermint beneficial for what they call headache relief when applied topically or even using aromatherapy. Yeah. In terms of potential worldwide impact, peppermint is actually grown in various regions and is used in the food, beverage as well, and also in herbal medicinal industries. Yes, another interesting one is what they call lemon balm. Yeah, some people call it Melissa officinalis. Yeah, in terms of component, it has what they call rosmaric acid in terms of essential oils. Now, it is used majorly for calming and stress relief. So lemon balm is used for its calming and anxiety in terms of reducing effect. It also helps in sleep aid. It can promote what they call better sleep quality and reduce insomnia symptoms. Yeah, and it's also important in terms of potential worldwide impact. So lemon balm is actually cultivated in several countries and is utilized in the herbal supplement and aromatherapy industries. Yeah, Another interesting one that we probably need to comprehend is what they call garlic. Garlic, some people call it what they call allium sabitum. Yeah, allium sabitum. Now, in terms of key component, it has what they call allicin and sulfur. In terms of advantages, it helps in terms of heart health. So garlic has actually been linked to improved heart health by reducing blood pressure and even cholesterol levels. Now, it also has what they call antibacterial properties, and it has natural antibacterial properties that may be used as a remedy for certain infections. Yeah, and it also helps what they call the immune support system. So garlic may enhance the immune system, helping the body to fend off illnesses. And in terms of its potential worldwide, garlic is widely cultivated and consumed as a herb globally, contributing to what they call culinary and even dietary practices in many regions. Yes, I'm going to give you another one also from our discussion from our book here, which we call astragalus. Now, astragalus memembranaeus, or some people call memembranaeus. It's in terms of key component, it has what they call polysaccharides, in terms of what they call flavonoids and what they call saponins. Now, in terms of advantages, it has immune support. So, astragalus is used for its potential immune boosting effect, helping the body to resist infection. And it has what they call adaptogenic properties. It's considered as an adaptogen in helping the body to adapt to stress and even maintain balance. And again, it's also helpful in terms of what they call anti-inflammatory, in terms of what they call astragalus, which has what they call an anti-inflammatory property that has benefit in certain health conditions. If you're arguing it in terms of potential worldwide impact, astragalus is cultivated in various countries, particularly Asia, and is used in traditional medicine practices. Yeah. Another interesting one that we may argue again from our book is what they call milk thistle. Yeah. Some people call it Silybum malaria. Okay, Silybum malaria. Now, in terms of component, it's also what they call Silmarium, which is a complex of what they call Flavonoris ganus. Yeah. In terms of advantage, it helps in liver support. So milk thistle is primarily used to support liver health and even protect it from damage caused by toxins and even diseases. And it's also used as an antioxidant because it has those properties, and therefore it has effects which help reduce oxidative stress. Yeah. And in terms of potential worldwide impact, milk thistle is actually grown and even processed in various regions, and it's utilized in terms of as a herbal supplement for liver support. Yeah. In terms of other things that we talked about in our book, we talked about the decriminalization and criminalization of cannabis, drug liberation, for example. We talked about the pros of cannabis, which I argued already, reasons to legalize or regulate cannabis, the economic of drugs in terms of medicinal herbs as well, and then the size in terms of the legal drug market as well, because we discovered that perhaps it appears that these things more than anything have a lot of advantages scientifically or otherwise, but I think the question is in terms of the quantity and the quality. Perhaps that's where we need to emphasize. Yeah. And then we talked about the different policies in terms of the different countries, and then advocation in terms of advocating for it. And then we also talked about the East African drug trade, and then the aspect of supply and demand, and then the perception of drugs as one of the components we also talked about. By the way, there's what they call saw palmetto. Saw palmetto has fatty acids, particularly what they call lauric acid and captic acid, which help in prostate health. Yeah. So when you look at saw palmetto, it's often used in support of what they call prostate health and even alleviate symptoms of what they call benign prostatic what they call hypersplasia, what they call BPH. And these are things again that I just don't know how best to tell them to you, but I'm just thinking loud that how about if we have a substantive regulation that incorporates all these, and then we see in terms of how to help our people, because we realize that the greenery has a lot of effect, healing effect. There's what they call green tea, for example, Camellia sinensis. Yeah, it has what they call polyphenols and also particularly what they call catechins and even caffeine. In terms of advantages, it is used as an oxidioidant in terms of effect. So green tea is rich in what they call oxidioidants and may help reduce oxidative stress and even the risk of chronic diseases. And it also helps in terms of weight management. It is actually used for potential in terms of aid weight loss and even metabolic health. Yeah, and even brain health, by the way. Some studies suggest that green tea may actually improve cognitive function and even reduce the risk of what they call neurodegenerative diseases. Yeah, and in terms of worldwide impact, green tea is actually cultivated and even consumed worldwide. It is actually significant in terms of the components of the global beverage industry. Yeah. So these are things that you look at and say, wait a minute, how about if we organize ourselves in a much better way? Not so. To continue with the book, we also talk about things like perception of drugs. We talk about aspects to do with opium, by the way, and in terms of heroin and marijuana and cocaine, and then what they call methamphetamine in terms of, and also cat and its effects. So all these aspects we talk about, as I said, we need to understand a legal appraisal of the drug use in terms of the legality of it, but also the institutional framework in terms of the potential for drug abuse. How do we have it in terms of a substantive health? Do we have substantive research, for example? Just talk about the issue that we had during the time of COVID. You remember COVID-19? I mean, when Dr. Guang came up with his COVID, the whole world was in head until the president had to throw him an olive branch and tell him, listen, I think this is, if you have evidence that it works, then why not go ahead? And it saved the nation. There's a guy called Dr. Sebi. Dr. Sebi is not even a medical doctor, but he was actually accused of practicing medicine without practicing certificate in the US. And he came up with one time in the courts of law when he was asked to bring people he had healed, because he had a range of diseases that actually were healed using herbal stuff, yeah, herbal and medicinal herbs, yeah. And then he was asked by court to bring about only 7. He actually brought about 107 people, including AIDS and the likes. So I'm not advocating for just a sweeping or an unregulated discourse in terms of medicinal herbs, but let's regularize them. Let's help them. Let's build substantive bodies that can accommodate them. And who knows what we can discover tomorrow? Who knows what these greeneries can actually can provide for us? It's even biblical. You remember the scripture where there's a man of God who was asked to eat, not to eat meat, and he preferred eating vegetables and greens. And when they compared them with the other guys who had been fed with meat, he was actually his body structure was much better. Yeah, who doesn't know that green meat in terms of has substantive effects on the body? Yeah, in terms of many other things. I'm not a medical doctor, but I'm arguing from a common sense point of view that it's important that we understand and comprehend the things. It's not just a question of it's bad. It's a question of proof. It's a question of benchmarking. It's a question of having a substantive legislative body that can be able to accommodate and understand the strength, the weaknesses. I am told that, for example, if you chew Miraa or marijuana, maybe a cup full of it, just that, it's not enough to intoxicate you to the extent that you can go berserk. If you compare that in terms of a person who has taken, maybe 2 bottles or 3 bottles of perhaps 4 or 5. I'm a teetotaler, so I'm not very good in terms of those components of drinking. But I'm told that a person to take perhaps 5 bottles of booze or whatever call it is equivalent to eating perhaps a whole sack of Miraa, which is practically impossible. Meaning that the person who has taken 5 bottles is actually at a more danger zone to life and society than even this other guy. So think about those comparative analysis and think about how it's important. So the argument here is not an advocacy for Njaga or for whatever. It's an advocacy for having a regulatory body or system or whatever to govern our issue. It's not a question of anymore to behave like ostriches where we put our heads in the sand. Yeah, it's a question now of discovering the good things that I need and regulating them, or trying to put substantive bodies to govern them, and they can help society. There's no doubt to the fact that the world may not be interested. Even at the invasion of COVID, remember how many people were able to accept it? Europe and America wouldn't accept it. There's a country actually that had an individual, one of the third world countries, where they discovered that COVID could go because of certain compounds in natural body compounds, and World Health Organization disbanded themselves from agreeing with what they were saying. We understand the regulation. We understand the aspect of the scientific proof, and then the aspects of quality vis-a-vis quantity vis-a-vis portions, so that people are not overdosed. But the point we're trying to say is that how about if we created a system that can accommodate all these things and help ourselves in terms of taking advantage of these medicinal herbs that we have, that have been given freely by nature and by God. Professor Guang is on record saying that there was substantively enough ingredients in Miraa forest and other forests that can actually generate, the ingredients that would help COVID to go and even help the entire world. Yeah. So I'm just thinking loud that these are important. They help in hormonal balances, for example, boost energy, endurance, stamina, even libido enhancement. The use of maca, for example, is important in terms of what they call aprocydic effect. It's important. So maca in itself as a greenery is primarily grown in Addis region, for example, South America, but even in Africa, for example. Dr. Sebi, as I told you, who is on record to have healed very many people, said, I used to go to Africa and most of these South Asian countries and look for those herbal roots and stuff like that, so that my people were treated. And he said the body, think about it, the body there's no disease that can live in a body that has an alkaline high level. In other words, so as long as you maintain your body with a high pH value in terms of alkalinity, yeah, as opposed to acidity, no virus, no disease can live in an alkaline environment. So he was actually agitating, or perhaps advocating for the use of foods that have high pH values. The foods like what? Like pineapples, for example. Foods like avocado, yeah, banana. So all these things that we have been gifted freely by nature, we better take advantage of them in terms of understanding and in terms of even growing them on a massive level, in terms of exporting them. I was in Europe and a small lousy rotten avocado much smaller than my hand here was being sold at about 50 euros. Rotten pineapples that you couldn't even, which would throw away here, was thrown at almost 150 euros. Think about that. How about if Uganda can just take advantage of these things and come up with a system that can create and in terms of, first of all, the legality of it, but in terms of the scientifics of it, but also in terms of the health of it, in terms of everything, all the components, in terms of the system, a substantive system that can create, a policy that can be able to help heal the world. Guys, we can do it. And that's the advocacy we're trying to make in terms of our appraisal, in terms of Njaga, in terms of Miraa, and in terms of other medicinal harms. And we're not simply saying that people should, take those things and go wild in terms of merrymaking and gormandizing, and we're just saying responsible cultivation of some of these things that have been gifted by what? By nature, as we so claim. Yeah? Okay. Other things that we talk about are issues in terms of the international legal framework in terms of drug abuse, conventions on what they call psychotropic substances, international narcotic control boards of 1992, for example. And then I know we have had unsuccessful intervention of drug abuse in Uganda, but those are things that we also argue in our book. And then aspects to do with the prevention of drug abuse through legislation, for example, and prevention of drug abuse through legislation in terms of, and then of course there's a whole detailed chapter in terms of medicinal plants, which I've just taken you through some of them, the advantages, evidence-based herbal medicines, problems that will be associated with them, and then what we call single plant herb studies, and then aspects to do with evidence-based herbal medicines, and then aspects that have to do with the what they call disadvantages of these herbal medicines as well. We also argue them and the challenges that are related to regulations of these medicines, and then the aspects of quality, safety, and then scientific evidence, which we cannot ignore again, and then the research in terms of these particular fields, and then the chemical components. As I said, I just argued the chemical components. We talked about all those, and then we also talked about the pros and cons, and these are things that are, as I said, are extremely important. So those of you who are hungry a little bit for knowledge, it's important that we open our minds and learn to think outside the box and throw the box away. Many of you probably you may remember, those of you who have not grown up in the cities, perhaps who have a little bit of being original in the sense that you've grown up from home, back home, you probably know how our grandfathers or mothers or whatever have given us certain components, and how we've been able to heal, by the way, even without necessarily depending on straight medical approaches. And I'm not saying that we need to go back there. I'm just saying that we need to refine, we need to make it better, we need to have options that resonate with the changing world. Because listen, even the so-called pharmaceutical medications that we use, many of these things actually come from these green herbs, if you like, and that's where they get the components. Aside from the fact that some are now being manufactured, and now there's a fear of a lot of foreign what? I don't want to use the wrong word, but foreign agents in quotes that have been used in chemicals, even in vaccination thingies, and we're now afraid of what, anti-malaria vaccines and the like. So how about if we get back to our things in terms of how Africa got to know and how got to do the things? As long as we regularize them, as long as we look at them in terms of what the science says, let's grow in that positive direction. After all, the invasion of science and medicine is believed to have started in Africa. I mean, I was amazed recently when I got to know that even things to do with childbirth, where you actually have to operate a woman, it began in Bunyoro before in the entire world. Think about that. Yeah, so many of these things are actually important. So my advocacy for you again is not to be a drum major in terms of advocating for the abuse and the misuse of some of these medicinal herbs, to use that phrase, but it's an advocacy for you and I to understand that, listen, much as they have side effects, much as there are people who have misused them, it's not just a question of making sweeping statements to simply throw them off. No, it's a question of understanding that how about if we look at the better side of the coin? How about if we took some advantage and studied them one by one? How about if we had a policy, a legislative framework that can be able to co-opt and adapt? How about if we had, substantive health institutions that can do extensive research in terms of understanding exactly what ingredients these things can offer and what dosages can be applied or given to the people, and how, don't you think that we're going to be the people to heal the world tomorrow? So everything I'm saying, my friends, is found in our book, and I pray that you take the liberty of taking the pleasure of visiting our website of lubogo.org and Suigenerislawup.com. Before I probably take leave, there's another that comes to mind, what they call eucalyptus, and some people call it eucalyptus globularis, if you use the phrase loosely. It has a component called eucalypto in terms of cinnamon, and also what they call terpenes. In terms of advantage, eucalyptus has advantages as far as what they call respiratory health, for example. So eucalyptus is also known for its potential to relieve what they call respiratory issues, including congestion and even cough. And it can also be used as anti-inflammatory. It has anti-inflammatory properties and has actually also benefits in terms of skin conditions. And in terms of its potential worldwide impact, eucalyptus is native to Australia, so I'm told, but it's also grown in various areas, and is used as also an aromatherapy in terms of tropical products, and also respiratory medicines as well, or remedies for that purpose. There is another one also that comes to mind, what they call Astragalus membranosus, which has what they call polysaccharides, and also what they call flavonoids, and also saponins. In terms of advantages, it is important for our immune system. So astragalus is actually used for its potential immune boosting effect, helping the body to resist what they call infections. So it has what they call approgenic properties, as I just mentioned. So these approgenic help the body to adapt to stress and even maintain what they call balance. And also, again, it has what they call anti-inflammatory, or what they call astragalus has what they call anti-inflammatory properties that actually may benefit certain conditions in terms of protection as well. And if you argue it in terms of potential worldwide impact, astragalus is actually cultivated in various countries, particularly in Asia, and it is used in terms of traditional medicine practices. Another that may come to mind for purposes of emphasis, because I realize the strength and the gravity of what I'm talking about, is what they call borage. Some people call it borago officinalis. In terms of component, it has what they call gamma linolenic acids, GLA, and it's used for as what they call pyrrolizide alkaloids. In terms of advantages, it's used for anti-inflammatory, and borage is actually used for its anti-inflammatory properties for the benefit of conditions like arthritis as well, and also the health skin. And it can actually help to alleviate skin conditions, including dryness and inflammation. Okay, in terms of potential worldwide, borage is actually cultivated in various regions, and is actually used in terms of herbal supplements, even as a culinary herb. I just mentioned quite a number of those. So, my friends, as I said, as we argue, as we think about these issues, we should not loosely interpret the argument for what cannabis, or even for the argument for cat, as a simple argument of people, having a question of a bang, or smoking or having a hula baloo for that effect. I know there are quite substantive abuses, and I know the effects that are likely to be that arouse out of the abuse of these particular greeneries. But the point is that how about if we regularize them? How about if we decriminalize them? How about if we educate the masses? How about if we go to the media and tell them, listen, this has this potential? Because listen, everything has its positives and negatives. So we cannot simply argue and say, take an example of a stone, any stone for that purpose. I mean, I could use a stone to stone you, I could use a stone to build a house. So how about if I say, okay, we are laying foundations or we are laying regulation that this could be used in this company? Okay, even sugar in its own sense has disadvantages. But how about we never ban it, we never go to people's homes and tell them, take 2 spoons or 4 spoons, we simply educate them. There are even more dangerous issues in the world today that even have even disclaimers on them. Not even disclaimers, okay, call them disclaimers. Take an example of cigarettes. Yeah, cigarettes today, I was in Europe and I saw people having cigarettes with real pictures of people who are dying of serious lung issues, serious cancer, bodies that are, in very sorry state. But the pictures are clear on the cigarette packs. But guess what? People were actually buying them, even when they know the substantive effect. How about aspects to do with Coca-Cola? The effects of what Coca-Cola has on the body. How about the so-called junk foods? The KFCs and the likes. How about, so it's not just a question of saying, listen, it's bad, it's terrible. It's a question of knowing, can we regulate these things? Can we have a substantive body that can look into this? Because when you really put these things on the weighing scale, other than the fact that people have abused them because they have taken perhaps a little bit more overdoses, to use that word loosely, I would argue that the advantages to these may actually be much, much, much more. So I think it's a question of engaging our scientists. It's a question of making being a drum major in terms of, as I said, creating policies. It's a question of saying, let's sit down with the powers that be and comprehend and understand. I know most of for example, Miraa and cannabis is a no-go area for our country, in spite of a recent decision that was trying to make an argument, although it was appealed against, the challenges that are associated with that. But I think the argument is, it's a natural growing whatever. How about understanding how we can manage it? I think that's the point that we're trying to say. I believe that perhaps God has a purpose for everything. Even this debate of, I don't want to use those words because perhaps this is a different argument, but let me say the debate, for example, of homosexuality, the argument of nature versus nurture. Yeah, you could argue and say most of these things are created, everything that goes against the order of nature perhaps can have substantive challenges. Not so. So we understanding that the abuses are there. Yes, we are understanding that the misuse is there. Yes, we are understanding that everything bad associated with that, especially if taken in overdoses, will have substantive effect. Even what you like most, mention anything you like most, as long as you do it in excesses, it will have substantive effects upon your body. But the point we are making here is, can we regulate them? Can we decriminalize them? Can we create an umbrella for reform perhaps? Can we have centers where we teach our people? If we told our people, in terms of how to deal with stress, for example, in terms of how to deal with depression, for example, in terms of how to deal with the job issues or abuses, so that people don't look at in terms of those as options for survival, or then we would have a better remedy. We'll have better remedies in terms of what these things can do for our lives and even for our nation. Especially the fact that we are blessed as a country in the sense that we have 2 climate zones, seasons for that purpose, compared to the other guys, and yet they are able to export food and these things to us. It's just incredible. It would be us actually exporting the food, exporting these medicines, exporting all these components to them. These are things that we need to think about extremely, extremely. Black cohosh, for example, what they call Arcteria remosa, has components that they call trypsin glycosides. It had advantage in terms of what we call menopausal symptom relief. Think about menopausal symptom relief. So black cohosh is primarily used to alleviate even menopausal symptoms, including hot flashes and even mood swings. Think about that. I know some guys here, I'm not making a kalango for them, who have specialized in some of these things. Some of you probably know Professor Bayo. And I've seen the incredibility and the beauty of some of the things that they do in terms of the getting of the nurturing, okay, and then the nurturing of this greenery and converting them into substantive use in terms of perfumes, in terms of pollutants, in terms of mosquito repellents, in terms of skin whatever. And these things have what they call adaptogenic properties. They can actually be used almost for every part of life. Perhaps it reminds us that God never made a mistake in the first place. In terms of energy, in terms of stamina, in terms of, rather than depending on genetically modified foods. Yeah? And that's another book that we'll look for, our book, GMOs. Yeah? Where we are actually being forced to eat fabricated or manufactured foods from libraries or for laboratories for that purpose. Yeah, and these have substantive effects upon our bodies, and they're deeply, causing us to have cancers and terrible issues. Yeah, so respiratory health, for example, lobelia is helpful in respiratory breath. It's known for its potential to alleviate respiratory issues, including asthma and bronchitis. Yeah, maybe that's why Africa didn't have a serious breakdown in terms of COVID, because of the fact that many of our people went green in one way or the other. Yeah. During COVID time, there's a guy who went and ate. A guy told me, you know what, me, I had no choice. Maybe he had a choice, but he preferred to, Lubogo. We call it Lubogo from where I come from. Lubogo, he actually did harvest it and then boiled it and then drank the water of it. And then the guy said COVID disappeared. I'm not making an advocacy. Please understand that I'm not a medical doctor. I am only arguing from an intellectual point of view. I'm urging in terms of what we need to do in terms of creating substantive regulatory framework for capturing all these what they call herbal or even medicinal plants for that effect. And I'm saying that in my opinion, it appears that we have more to lose if we don't do that. We're probably going to rely on pharmaceuticals to bring imported and fabricated whatever's from wherever they come from, rather than creating rather than creating our own empire of sorts, so we can be able to export. As I said, God has given me the opportunity to travel, but I can tell you for a fact that there are many things that we can export in Europe, and we can actually cease to be beggars. Yeah, because we are blessed by nature. We have these things that can easily, this country, we can throw a seed anywhere and actually, generate and grow. So these are things that I'm talking about. It's important, my friends, to think widely, to think outside the box and throw that box away. So my book is readily available. Those of you who are interested in finding it, you can go to lubogo.org or suigenerislawup.com. This talk of medicinal, or what they call the medicinal herbs or whatever, does not end. I keep thinking about things that come. I think about what they call sage or salvia or finalis, for example. It has what they call rosmanic acid and even essential oils. It has cognitive function in terms of what they call enhancing memory and cognitive functions. Rather than wasting our time going to witch doctors and telling them to improve on our study abilities or whatever, or potential abilities to act in certain ways, which reminds me of our book, Witchcraft and the Law. Look at it. We made arguments in terms of why witchcraft becomes an omniscient threat, this ever-present threat, and the fact that people lose direction because they don't understand how to proceed in terms of the legal aspect of it. Horsetail, for example, what they call Oscillatum avense, it has what they call salicylic acid and even flavonoids. It helps in terms of bones and in terms of joint health. Horsetail is actually used for its potential to strengthen bones and even have what they call connective tissues. It even helps in the hair and the skin health. It may even improve the health in terms of appearance of your hair and skin. Think about that, your appearance of hair and skin. Think about that. It has even what they call diuretic. Horsetail is actually used for diuretic to alleviate water retention. What am I going to say? Almost everything that science discovers is already provided for by nature. There's what they call the devil's claw. Some people call it hypogaphytum, procumbens, and it's in terms of hypoglossite, it has what they call aridoid glossoids. Yeah, in terms of advantages, it has what they call anti-inflammatory. So the devil's claw is actually used for its anti-inflammatory properties and may even benefit conditions like arthritis, okay? And it's also a pain relief in the sense that it can actually alleviate pain associated with various health conditions. And if you're arguing it in terms of potential wide impact, it is native to Africa, yes, and it's used as a herbal supplement even in traditional medicines, yeah? So, as I said, the story can go on and on and on and on. But I think if there's anything that Africa or Uganda perhaps can capitalize on, it's a question of the greenery, it's a question of the beauty of the climate that God has given us, and it's a question of taking advantage of these medicinal herbs and understanding them that have been used for centuries as traditional medicines, and understanding that instead of grafting on foreign medicinal options, we should probably reinvent ourselves and try to comprehend them, but of course with caution and with consultation with professional healthcare, as I said, and also with underlying medical advice from professional medical people, and it would help us in terms of creating a sustainable and responsive harvesting of these herbs in terms of protecting our natural habitats to ensure their availability for the future generation. So it's very, very important, my friends, as we make this discourse. And I wouldn't want to add anymore. I would like to thank you, ladies and gentlemen, for your attention. But please take liberty and visit our website, lubogo.org, and suigenerislaw.com, where you're going to find quite interesting arguments. And we believe in what the great Bernard Shaw said: most men see things as they are, and that's why we dream of things that are not and ask why not. So blessings and thank you for your attention. My name once again is Isaac Christopher Lubogo. I'll take leave. God bless you. Thank you.